Hello, I am Dr. Rajiv, pulmonologist at Mamata Hospital. Today we will know a few things about bronchial asthma. Bronchial asthma is a heterogeneous disease with chronic airway inflammation. It is characterized by respiratory symptoms such as chest tightness, wheeze, cough, and shortness of breath, which vary over time and intensity and with varied airflow limitation. So what is it? It is actually any person who has atopy and who has a genetic predisposition for asthma. When an allergen enters his airway, the airway epithelium reacts against it and releases certain chemicals called interleukin 5 and interleukin 13, which in turn bring about inflammation and the recruitment of mast cells and eosinophils. This mast cell degranulation releases other chemicals called prostaglandins and leukotrienes, which in turn cause diffuse airway inflammation. It brings about airway hyperresponsiveness and mucus secretion and bronchospasm. These three things bring about the symptoms of bronchial asthma. Because there is increased mucus secretion, there is cough. Because there is smooth muscle spasm, there is shortness of breath. These are a few frequently asked questions from patients who are on treatment with asthma. Doctor, I have already been using certain medication for asthma, but why does my asthma frequently exacerbate? And are these medicines addictive? So answer for the first question. There are many reasons why a patient who is already on adequate treatment for his asthma can exacerbate. For example, if he gets a new onset infection, a viral infection such as common cold, or any bacterial infection like pneumonia, his asthma can exacerbate. Also, normal females who are using inhalers during pregnancy, their asthma can exacerbate. If patient gains weight, asthma can exacerbate. There is obese patients have an increased risk of having higher severity of asthma. Also, if the patient develops gastroesophageal reflux disease during the course of treatment of asthma, there can be an exacerbation of asthma. If patient has been started on newer drugs, for example, AC inhibitors and beta blockers or aspirin, these drugs which are usually prescribed by cardiologists, in the course of his treatment with asthma, if he starts taking those drugs, then his asthma can exacerbate. Other than this, if the patient doesn't take his inhaler properly and if he quits using inhaler in the course of treatment, if his adherence is not right, there is an improper technique with which he takes his inhaler and the drug doesn't get delivered properly and his asthma can exacerbate again. So for the second question, is it addictive? No, inhalers are not addictive. There is no addictive drug which is there in the inhalers. But patient gets a higher comfort while using these inhalers, and if he quits using, he feels he's not that active or that well, because with his inhalers he is very active and has no symptoms of asthma. So asthma can be well controlled with good adherence to treatment and proper therapy. Stay healthy and continue your health education.